Muchísimas gracias.
Thank you very much, Jorge. And thank you very much as well to Dr. Fernando Martinez Canyabe, the head of the Health Department of the City Council of Seville. And in the second part of the session, we're going to focus on the second section. We're going to have another round table of experts who are going to talk about civil society responses to eliminate HIV-related stigma and discrimination. To the extent possible, we're going to try to ask you to please keep within the time slot allocated to the session. The moderator will be Dr. Sanjay Bhagani from the EACS and Dr. Stela Bivol from the WHO Bureau. So without further ado, I'd like to give the floor.
Good afternoon, everyone. Happy to see still enthusiasm on the faces after a long day in a welcoming, warm Sevilla. And we are happy to, together with Sanjay Bhagani, to be co-facilitating this next roundtable. In the first half of the day, we heard about the challenge, we heard about the commitments, we heard about the work that has been done with a lot of focus and the efforts made so far under the leadership of Spain, the communities in Spain. And as now we start thinking about from commitments to action is also an opportunity to think about, so what has been achieved so far? Because civil society is at the forefront of ending stigma and has been at the forefront of ending stigma and discrimination efforts in the region across all the countries. So now today we are joined by a wonderful panel of people who have been working to end stigma for many years in the region, in the countries, and they have covered different angles and and have supported access of different groups to services. So without further ado, we would like to first ask our participants to introduce themselves, and then we will take one by one to work to speak on your successes. So I'll start from my left-hand side. Nikos, please.
So, hello, Nikos, Dedes from the Association of People Living with HIV and of Greece, and with the European AIDS Treatment Group.
Mm-hmm.
Hola, soy Ricardo.
Good afternoon, I'm Ricardo Fernandes. I'm chair of the EATG, the European Organization of Activists, working with HIV and AIDS, and it's an honor to be with you this afternoon at this meeting with our European friends. And I'm obviously extremely excited with the results that will be obtained from this meeting.
Hello.
Yes.
Hello, my name is Denis. I work with an organization called Africa.
No, it's not working.
No, Mike. Yeah, try now.
Okay. Hello, my name is Denis Onyango. I work with an organization called Africa Advocacy Foundation. That is based in the UK and in the Netherlands, and working across 10 European countries, including Belgium, Greece, Germany, France, Portugal, Sweden, Cyprus, as well as France and the UK.
Buenas tardes. Soy
Good afternoon, I'm Reyes, I'm President of CESIDA, the State Coordinator of HIV/AIDS Spain, and I think that this is probably one of the most exciting times of the last few years of the AIDS epidemic, so thank you very much for letting me be a member of the panel, and I would like to thank you for what we have achieved during the past years.
Dovbakh, Eurasian Harm Reduction Association, from Ukraine, living in Lithuania, and very happy to speak to you.
Can you hear me
No.
now?
You can come here. Come here.
Yeah.
Should we try this one? Yes, this one's working. Okay, so we have one panel member who is not able to be with us today. So let me introduce him. He's sent a little video as well. So this is Pietro Barbieri from the European Economic and Social Committee. Unfortunately, for personal reasons, he couldn't travel. So we have a full panel now. And what we thought we should start off by doing is just give each of the panelists a few minutes to tell us about the work that they have been doing and what the community response has been so far. So where should we start? Should we start with Nikos and then work downwards? Or...
Sure.
Okay. Well, first of all, many thanks for Julia D'Alamo for her work and for the invitation, and for the whole Spanish colleagues who have worked to put HIV on the priorities of the presidency, and indeed to the city of Seville and all the good work that they and the community have been doing to focus particularly on stigma. Now, there are three things that I believe that we in the community, we have to do going forward, and those three things should be focusing on data, on coalitions and partnerships, and leadership that we should be providing. Luis earlier said that the problem of stigma, besides the threat that we have all seen with the early depictions of HIV and death and sexually transmitted infections and whatever it's meant back in the 80s, the fact is that stigma exists because of which are the most vulnerable and affected communities to HIV. And in order to be able to address and battle stigma of HIV, we as society need to address all of those things that we know, gender inequalities, racism, homophobia, transphobia, sex workers, people who use drugs. So I think we have a lot on our plate. I mentioned data, and I will read you just a few of them. In 2021, in the 40 years anniversary, we conducted a research to the Greek public, and I'll just read a couple of you, that 29% believe that it's danger to society. People living with HIV are a danger to society, and they should not be working in common jobs. 36% believe that transmission can also occur through kiss, and 41% through the use of toilet. I mean, this is just incredible and impossible to believe data. So my first request towards the Spanish presidency and the agencies which are here is to repeat the Eurostat survey from 2006 and see, because these were questions that were in those Eurostat, and see what the citizens of Europe believe and understand about these basic things. And when you start with that, you can, and I was just saying that we have underlying stigma and discrimination, but what about the threat, the horrendous threat of AIDS coming in? So this is something that we should be addressing. The other thing that I believe that we should be doing this together in partnership, Simone many times before in the previous session mentioned this, and here we have a partnership, and the whole meeting is a partnership. And I think also that the scientific societies are also part of the civil society. They're not statutory organizations, and I'm very glad that the three presidents of EACS, Sanjay, Esteban, and Milos are here. I haven't seen 3 EACS presidents in any one meeting, which is not a medical meeting, other than the one that they organize themselves with the standards of care, which is very good, I mean, which is not medical, great work there. So in Greece, we have somehow managed to engage at a high level. Certainly the 40 years anniversary helped when the President of the Republic visited the Athens checkpoint, which is the community-based testing facility. And last year, the Prime Minister on December 1st visited our premises. This was linked with the kudos that they wanted to collect from a series of legislative initiatives that they undertook. So this is another suggestion, that legislative initiatives are for free if we can manage to take them from the state. So, for example, I mentioned earlier that assisted reproduction for people living with HIV was not allowed in Greece. Ridiculous. People who cannot serve in the army or in the police, you know, why not change that? Easy, free of charge. I mean, the UK armed forces and the US did it just last summer. So there are a couple of things that I think once we do them and get the publicity, that they will help. So I'll stop here and I'll come back later because I'm sure my colleagues have many more other ideas.
Thank you, Nikos. I have to say that I've not seen 3 EATG presidents in one place, and so we've certainly got at least 3 EATG presidents here, and probably more. So welcome. Ricardo.
Thank you everyone. Me encantaría de hacerlo en español.
I would have loved to have given my presentation in Spanish because, contrary to Luis, I really love to speak my Portuñol, which is a combination of Portuguese and Spanish.
I think that to start, I think the title of this conference, of this table, is one of the answers, I think, to stigma and discrimination. We need more community responses, and there's not enough community responses all over Europe, especially in Eastern Europe. So that's one of the things that we need to work to have more. I'm not saying that this is the solution, because we need, of course, to strengthen also public health responses to the epidemic, and to strengthen also the HIV related stigma, to make sure that this doesn't happen, because in all the stigma index that we've been seeing in countries, including my own country, Portugal, we've been seeing that healthcare settings are the ones where people experience more stigma and discrimination. That being said, I think that we are talking about stigma and discrimination, and this is a pandemic inside of a pandemic, and we need to see it as such. We need to treat this disease inside of a disease. We already talked about that this is not only related to HIV, it's related to the people themselves, who they are, what are they doing, where they are coming from. So this is also very related to the stigma, because our population, sometimes they are already stigmatized before becoming HIV positive. So this is something that we need to talk. We need to talk about sex as well, because everything that is around sex, it's taboo, it's stigmatized as well. So, and if we don't understand that, we will not be able to tackle stigma either. So I think that one of the important things, one of the first things that I learned when I start my work as an activist, it was, now we have the 95, 95, 95, 10, 10, 10, but at that time it was know your epidemic. Mm-hmm. And we don't know our epidemic of stigma and discrimination. We need to know what is happening. Nikos told about repeating Eurostat. I would say we need to have indicators in countries, because otherwise, how we will know if we are progressing or not? You know, stigma index, they are not enough, they are not being founded. So we need better tools to measure stigma in Europe. So I will urge, European Union to think on how to measure. We have here agencies that work on stigma, so and other data. So let's find a way to, and fund a way to retrieve data. Another thing, that map of the global partnership, we need to fill that map. It was red, wasn't it? So it needs to be all red. And this is not, we don't have 10 years to 2020, we have 7. And we need to fill that map, not next year, this year. We need to fill that map, because otherwise we will not have the compromise from the organization. So we need the leadership, we need the data as well, to make sure that we have all the tools to tackle the epidemic. We need the community as well. I'm going to stop here as well, but I just want to add something, because I didn't heard it till now, and I think that it's also my mission to talk about it. And we saw it with COVID and other diseases. Solving stigma and discrimination, it's not only solving the European problem, it's solving the world problem. So we need to bring our solidarity with the South as well, and to think that if we don't solve the problem in the whole world, we will not solve in Europe or anywhere in the world. Thank you.
Thank you very much.
Thank you. Now let's move on to Denis. Denis, you have been working with probably the most underserved populations across Europe, in terms of intersectional stigma, so to say. So what do you see as solutions moving forward in terms of, and again, you probably have tried many things, right? So it would be also good to understand what you've tried and what you've seen work, and what you see as a path forward in terms of where to focus work on addressing this intersectional stigma across Europe.
Thanks, Stela. So I just want to say thank you for involving me. Julia, thanks for the team for inviting me to be part of this conversation. Yes, I would like, first of all, to give some bit of background in terms of what we do. So as I said before, we work with migrants specifically in Belgium, Cyprus, France, Italy, Greece, Germany, Netherlands, Portugal, Sweden, and the UK. Last year, we tested 2,450 people, migrants, and with a prevalence of 6.4%. And of course, higher if you look at people who inject drugs and MSM, ranging between 16 and 24. So that's a context. But I also just wanted to reflect on my personal story. I come from Kenya, and I've lost one brother and 3 sisters to AIDS-related complications. Before I came to Europe. And recently, I lost a cousin who took his life, ate rat poison, because he discovered that he had HIV. And so stigma is something that I feel every day. At the time when my siblings died, we could not even bring ourselves to talk about what they died of. And of course, the landscape in Europe is different, but people who come from these parts of Africa still have these kind of misconceptions and barriers around understanding that HIV has changed. We have excellent treatment, we have easy testing, but that's still not the case. You see that the situation in Europe, 42% of people who were diagnosed last year were migrants. Out of those, 56% were actually diagnosed late. And that's an indicator right there about why we need to address stigma. But also, I think that in terms, Stela asked me about the solutions. And I think that for me, we've talked about stigma a lot over the past 2, 3, 4 days. And I think that the solutions for me, I could, as someone who works with patients, I can actually address some of the problems that they come with individually. But I think in the whole, when we're looking at policies and issues around how we want to get to zero, we cannot pretend that we are not seeing what's happening in terms of the policies. We still have 9 countries in Europe that deliberately have policies that bar access to treatment for migrants who are undocumented. I mean, we are all public health professionals. How does that make sense? And why do we deceive ourselves that we are actually going to get to zero when we know very well that out of the 14,000 migrants diagnosed last year, probably about 5,000 are undocumented. Even in England, where they're trying to look for the last 4,000, most of them are undocumented. So I think that for me, the solution really lies on policies. We've got people who are coming to Europe, men who have sex with men, who have got post-immigration acquisition of HIV up to around 72%. And the assumption that gay community is well served and they know everything, you know, they can access healthcare is a myth. I just want to end quickly with the case study, quickly, because I know that we have to move on. A lady came on a care visa to the UK. She fell sick after 1 month, was hospitalized for 2 months, and she hasn't been able to work for the next 1 month. She's run into debt. The company that she works for wants to see evidence that she was sick, and she cannot take that evidence because she doesn't want to disclose her status. So she's behind on rent, she's in debt, she's borrowing money from friends. And that right there is what you should see you should see how stigma impacts people. So yeah, there are so many suggestions which my colleagues, of course, have talked about, but I think that we need to address the fundamental issues, which are really the laws and then just environment, hostile environment that really drives people into destitution and difficulties. Thank you.
Thank you, Denis.
Thank you. Thank you, Denis. So let us hear from Ms. Reyes Velayos, the president of CESIDA in Spain. And I think you can also share, we've already heard... we'll show at the end the video. But I think you have many examples to share of community action on how to address stigma and discrimination. So the floor is yours.
Thank you very much. I'd like to start by showing you a video of just about 1 minute, which will present the latest project that CESIDA has launched in order to address stigma and discrimination. Unfortunately, we cannot hear the audio. I apologize, but we're not receiving the audio in the interpreting booth. What isn't talked about and is not revealed in the street apparently doesn't exist. It's a way of showing that HIV exists, but HIV is not an obstacle for society. The project consists in vindicating that with a smile on the face, when 300 people, Spanish people have HIV. This is very important because the first time that many people who live with HIV will increase their visibility together. I've been invisible for 30 years, more than 30 years. I kind of wanted to hide away, but all of a sudden, I thought this was my opportunity. I felt a sense of liberation. It's almost like you've taken a weight off your shoulders. 2 hours in the theatre, one about men with HIV and another project of women with HIV, and a film cycle, sports, training, and also vindication.
El Pride Positivo
Well, Pride Positivo was launched in 2022 with a view to drawing attention to the persistence of stigma and discrimination related to HIV. From this project, which we actually implemented over a period of 4 months, the last 4 months of last year, well, one of the results was the trailer you just saw. It's a trailer for a documentary which, thanks to social media that we mentioned in this session, and also the filming platform, is a tool which will allow us to reach many people. So thanks to the first Pride Positivo program, hundreds of persons were able to make themselves visible as people with HIV. They actually were able to come out in the open. And there was a phrase at the end, I think, which wasn't mentioned, but I think I'm going to try and be brief. But I believe it's important to mention this. I think through the visibilisation of so many people with HIV who are able to go out into the streets and claim their rights, and with a view to enhancing their visibility to end stigma, well, in addition to thanking them for doing so, I think it's time that we can actually say that against stigma and discrimination, silence is over. It's a thing of the past. And apart from this project, which is our star project, our flagship project, since 2018, and thanks to the joint work with the Ministry of Health, with the division, and of course Julio Delamo, who I would really like to thank for all of the achievements that we've managed to obtain with civil society, with CESIDA, and with other supportive entities. Well, we have to share these achievements, and I'd finally like to just highlight some challenges, but I'd like to start with something positive. The social agreement for non-discrimination and equality for persons with HIV, the elimination of HIV as a reason for exclusion for access to any public employment, and also the public, the security forces in Spain, which was achieved in 2018. It was one of the first achievements that we obtained, and this year we've also managed to ensure that there's no exclusion for persons with HIV for working with weapons in private security. We've also managed to achieve PREP. With a pandemic in the midst of all this process, with COVID, we managed to roll this initiative out throughout Spain, and it's working very well. It can clearly be improved, it's one of the challenges, but it's working very well. And we've had fewer HIV infections annually thanks to the PREP mechanism in place in Spain since 2019. We also improved the integral law for equal treatment and non-discrimination, which for the first time refers to xenophobia as a cause of discrimination, which also provides opportunities for social entities to act as, let's say, witnesses in legal proceedings. And there was also an agreement with ESPO, which was the Spanish Association of Insurance Entities. It's an entrepreneurial association which groups together insurance companies in Spain. And this will try to ensure that our agreement with them will ensure that we can gain access to insurance policies for people with HIV. I don't think I've missed any achievements. And in terms of the challenges that remain to overcome the stigma associated with HIV, first of all, we have to reduce the late diagnosis figures, which account for a huge percentage of these diagnoses. The implementation of HIV services for simple treatments and samples, which allow us to overcome many of the problems that really undermine the quality of life of patients, focusing on their individual problems and focusing very much on the individual features and characteristics of single women and elderly people. We also have to reduce waiting lists to improve access to PREPs. We've managed to make great strides forward in this respect, but we still have to eliminate these waiting lists. And we also have to guarantee access to all people, for all people to HIV treatment independently of their administrative position, the time of residence or stay in Spain, within the regional autonomous community where they live. And to achieve this, it's essential that we approve the law to implement measures to achieve universal access to the health system, in thus guaranteeing that it's fully inclusive, recognising the right to health care in equal conditions for all people who live in Spain. We've also advanced tremendously. We've made great progress in some regions more than others, but we have to continue improving. And of course, we really need a response on the part of public administration. We also need a speciality focusing on infectious diseases, and also the inclusion of persons with HIV in different research therapies, particularly those relating to cancer. And there's not much more for me to add. Once again, I would like to thank everyone for being here today. And I'll repeat what I said before. I really believe that with this year, we're going to repeat this initiative of Pride Positive, or Positive Pride, and it's going to be held on the 21st of October this year in Madrid. Silence is over. We're talking about stigma. We're going out into the streets, and there will be no more silence on this subject. Thank you.
thank you for an inspirational but also tangible illustration of what civil society can do to address stigma and reduce stigma. And indeed, in addition to data for statistics, just showing faces of people in the street is another very powerful visual way to, and the most powerful way to show we are here. Let us have a normal life and go on with the life in a normal way without putting the stigma, right? So now we are going to go to Ganna, Dovbakh. And just as an introduction, Ganna has 20 years of activism and working with people who use and inject drugs in over 29 countries. So it's a wealth of experience of trials and errors of different approaches, ranging from advocacy to training to legal action to all kinds of things. So in your perspective, Ganna, what it is that has been achieved and what it is that we need to achieve, especially for people who inject drugs and use drugs across Europe?
Yeah, if I have 1 second, then I will ask you to remember Amsterdam to say, chase the virus, not people. You do remember our campaign, regional campaign. It's some respond to all what we're doing, and we are happy that now the slogan is in Global AIDS Strategy. But very short. I'm happy that here we hear the double stigma. I guess that we need to hear the word decolonization as well. Like Christopher Columbus start very dangerous colonizing process, and maybe civil could stop this process with colonizing people and killing people. What was started from okay, he's symbol. He's not started on his symbol. So maybe this is a good place to start the opposite process. And it's not only about the like people who use drugs and people who who are sex workers, LGBT, but also the people of color and people of other nations, and you know what I'm telling about. So what we are doing in 29 countries, we are documenting cases, but only data will not change the situation. What will change is a pressure on government and punishment. And that's important part, like we need, first, there are two directions what we are doing with the protecting rights. One, to help person, and that's legal and paralegal services, if we are lucky to have harm reduction in the country and in the city, if they are lucky to have enough funding for legal services and mental health and psychological services in case of violence from police or from or some injustice against them. So that's first, to help person, and then to get cases to advocate and to make a pressure and to make changes in the procedures. That's what we believe in. In what we are doing actually is to bring cry and screaming about the pain from community to UN treaty body, and through UN treaty body, through all the mechanisms we are trying to push on the states, because majority of our states, some of them EU members, but they still have this post-Soviet feeling of the power and possibility to have a power over the people and not the law and policies. So sometimes reputation from UN treaty body could pressure and to change situation. Actually, you hear that for us from 10 targets, the last 10, about the less than 10% of countries have punitive laws and policies. That's the crucial. So actually, all of our members, we are harm reductionists and community members. We are reducing harm of criminalization, because drug use don't do such a lot of harm as criminalization does. And we are reducing harm from repressive, mainly state violence against people who use drugs. That's what we are doing, and that's what we believe we need to change. Using the harm reduction principle, the small step to the dream is a big victory. Then we are really celebrating now this meeting, and we're celebrating that we have a lot of trained paralegal, we have a lot of cases documented, we have a lot of states who have obligation to change the law, which is criminalizing behavior or which is reducing access to life-saving services. And speaking about life-saving services, I know that I speak to European audience, and some of you providing services paid by municipality, and usually harm reduction is justified through HIV service, HIV prevention. But we all know that HIV prevention, it's just maybe 10% of all services needed. People can't feel the need in testing or prevention. They feel need in legal protection, in housing, in food, in documents to bring kids in the kindergarten. That's what they need. That's what they desperately looking for. And harm reduction, comprehensive one, that's what it is about. That's why we're speaking about investment in community-based services, which will give this protection to the people. And with this investment, like, I would love to say that Europe, in the dream world, in the pink pony world, EU member states should be this 10% of all states who are protecting rights, who are providing services, and who are involving communities. And it's happening. And I'm very happy that plenty of stuff is already here, from Lisbon to Tallinn, we have plenty of examples, and we are using them, we are filming them, we are showing them to members from the countries who have the services, like Bulgaria or Romania. Like, they don't have these services, and we're showing, look, it's not cost a lot. It's not cost a lot, the services itself. It could be low threshold, I don't know, majority of the community-based services, they look very simple. They could be in the very, very cheap place. They are getting premises for nothing, but they are the crucial, because you could have a shower there, you could have a food and sandwich there. So you know all of this. I will not preach into the converted, but in ideal world, again, European agencies have resources and possibility to support neighboring countries and candidate countries, because we have Balkan countries who are, from activist and citizens' point of view, want to join Europe. From state, they are a bit more totalitarian in mind, post-Soviet. The same with Ukraine, Moldova, Georgia. Ukraine is doing a lot, but if Europe will be equipped to give clear drug strategies, clear recommendation and support in this, it will be much easier for us to overcome a lot of barriers. And one more issue, I'm working for coordination all the time. And for us, it is important that in European level, we have Civil Society Forum on Drugs, Civil Society Forum on HIV, hepatitis, and TB. We have working group with UNODC on HIV response. And this is working mechanism to support coordination of civil society. And we are encouraging all of you to use these mechanisms to delegate, to get the message, to get volunteer support to any EU document. And one more stuff is about role of Europe, and I need to thank you all, your countries, you as a taxpayer, for contribution in support us in Eastern Europe, who is not European members, with the contribution, financial contribution to Global Fund, because without it, there will not be harm reduction at all in majority of the globe. Please remember that's important role of importing human rights values to the world. Thank you.
Thank you.
As Sanjay already mentioned, we have one virtual interventions from Mr. Pietro Vittorio Barbieri from the European Economic and Social Committee. So I would appreciate running the video.
The video?
The video, yes.
Yeah.
Allow me, first of all, to thank the Spanish presidency because with this initiative, it has given the European institution, organized civil society, experts and professionals the opportunity to focus attention again on the topic of HIV. Too many years have passed since the last European initiative on the matter almost signifies to signify that the emergency was over. It is true that data from Western European countries show a significant reduction in the risk of incurring contagion. It is equally true that the testing and drug treatments in the same countries seem to work. The same cannot be said, however, on two other fronts. Eastern European countries, and perhaps especially those beyond European borders, show worrying data. Given the immigration also due to the Russian war of aggression on Ukraine, we must expect growth in the data also in the countries of the European Union. Then there is the theme that the Spanish presidency wanted to put discrimination at the center of this attention of all of us with this initiative. The European Economic and Social Committee is a consultative body of the European institutions made up of all the European representations of organized civil society, in particular businesses, trade unions, and the entire vast world of association, cooperation, consumers, liberal professions, and small businesses. The EESC has the task of giving opinions on each draft European directive rather than on the initiative of the rotating presidency of the European Union. It does so with a democratic process in which the convergence between the different interests represented is the guiding light. The organization representative constitutes another fundamental vehicle for the implementation of the principal values as well as European directives. In the study group created specifically for this initiative, the debate was very lively among colleagues and with experts that we've been calling to give a contribution. The sources of discrimination for people living with HIV are multiple and affect their lives in a variant way. We are talking about access to treatment and testing, which is not guaranteed everywhere in the European Union. There are privacy violations also involving healthcare workers. Discrimination is quite heavy in access to work and career advancement. One of the most silent and horrible discrimination is in accessing mortgages and loans. In short, practically in every field of social and economic life. Considering this situation as widespread, it was unanimously accepted by the European Economic and Social representatives. I do not consider this fact to be taken for granted, given that among these representations there are also those which obviously non-public bodies that carry out such discrimination. But there is more. The discrimination is unfortunately an heritage of the civil society in general, and the representative of organized civil society are not certainly away from this context. However, This is an awareness that the European Commission chair, by von der Leyen, wanted to strengthen the European paradigm, the union of equality. It is about giving strength to the idea that European is a single market, freedom of movement, and overall is founded on human rights for all and on the rule of law. The union of equality have been giving rise to the different 10-year strategy on the issue of gender discrimination, disability, migrants, and Roma. This initiative of the Spanish presidency goes to implement the area of discrimination that must be overcome. For this reason, the EACS has decided to side with the Spanish presidency in this complicated but obligatory path. If the most authentic inspiration of the European is our beacon. I would have liked to be present and listen and share, even in informal ways typical of these initiatives. Unfortunately, last-minute personal reasons prevented me from being present in Seville. With this message, however, I want to assure all the support of the committee on such an important issue. That's all of my side. Thank you.
Thank you very much. So, unfortunately, we're running out of time, so we've got to end this session. But a huge thank you and a round of applause to all our panelists, and really many apologies, because I know there was plenty of discussions, but we can continue having discussions through this evening. So thank you very much. Thank you.